Hello people, in this video we want to look at the complications of myocardial infarction. So following an acute attack of myocardial infarction, only some cases won't develop in complication, but 80% of the cases will develop complications. Okay, so you can understand why this question is very important for exam, right? Because 80% of the cases develop complications. So immediate mortality is about 25% from acute myocardial infarction, sudden cardiac death. So otherwise you can see the complications here. So you can say 80% of cases, that is percentage sign, 80% cases will have complications, 25% cases there will be death, okay. Immediate mortality can happen. Now look at the complications. Arrhythmias. Arrhythmias are abnormalities in the normal heart rhythm, right? So basically it is one of the complications of acute myocardial infarction. This occurs due to ischemic injury or irritation to the conduction system. So basically whenever there's problem in the electric conduction system, right, there will be abnormal rhythm. So you know that how normal action potential of the heart is, right? The sodium influx, the potassium, the calcium, how these ions go to balance this action potential of the heart. So basically, what kind of arrhythmias can be there in a myocardial complications? There can be sinus tachycardia or bradycardia, atrial fibrillation can be there, premature systoles can be there. So you know the types of arrhythmias. So these are the words that you hear, right? Fibrillation, extra systoles or premature systoles, bradycardia, sinus tachycardia. Right? The most serious thing is the ventricular fibrillation, which can be responsible for cardiac death, right? So basically ventricular fibrillation can lead to death. So basically, do you know in arrhythmias the categories? You can have tachycardia, then you can have or tachyarrhythmia you can say, then you can have flutter, and the highest is going to be fibrillation. Fibrillation is going to be the most severe, which can lead to death. Then there can be congestive heart failure, guys. About half of the patients with myocardial infarction, they develop congestive cardiac failure. Like right ventricular failure can happen, left ventricular failure can happen, or both ventricles can fail. So basically it is responsible for 40% of the deaths from acute myocardial infarction. So this one can lead to death again. Right, ventricular failure. So about 40% of the deaths are because of this complication. Okay. So shall we move on to cardiogenic shock? So cardiogenic shock, in about 10 persons with acute myocardial infarction, they develop cardiogenic shock, which is characterized by hypotension and systolic blood pressure of 80 millimeter of mercury or less for many days. So basically systolic blood pressure will be less than 80 millimeter of mercury, right? Systolic blood pressure less than 80 millimeter of mercury. Hypotension, this is what it is, right? There is less blood pressure. And this can be accompanied with shock, right? Shock may be accompanied with peripheral circulatory failure, oliguria and mental confusion. So there will be shock. Basically here you have to know shock. The word is shock. Mural thrombosis and thromboembolism. So the incidence of thromboembolism from intracardiac thrombi. So because of intracardiac thrombi, there can be thromboembolism. There can be thromboembolism from thrombus in the leg veins also, right? So basically this will also account to death. This also can lead to death, thromboembolism, right? In 12% of the cases, major cause of death in 12% of the cases. Mural thrombosis. What is this mural thrombosis in heart? Develops due to involvement of the endocardium. When the endocardium and the subendocardium are involved, right, there can be mural thrombosis due to slowdown of heart rate. These mural thrombi itself, they can form thromboemboli, okay. So basically you know what thrombus is, right? It's nothing but blood clot. So this blood clot can become an emboli. This thrombosis can become an emboli. That means it can block something. So this is a emboli. So this is thromboemboli if it has all the platelets, etc. So basically they are saying a mural thrombi can become a thromboemboli. Mural thrombi is where because of involvement of endocardium and subendocardium. Okay. Mural is what? Wall. Okay, then this can happen even in people who are in bed rest, right? There can be a thrombus in the leg, which can then become an emboli. So there will be thromboembolism. Okay. Let's move on to rupture. What is going to rupture here? A rupture of the heart itself occurs in 5% of the cases, causing acute myocardial infarction, death. Okay. So basically in 5% cases, heart itself will rupture, right? Leading to death. So rupture often from the infarcted ventricular wall. So it occurs from the ventricular wall. Not sure why the focus is a lot on the ventricle. Ventricular wall itself will rupture, right, leading to death. So basically, the ventricle wall will rupture into the pericardial cavity, causing hemopericardium or tamponade and tamponade. Okay, two things are caused. Have you heard this word tamponade before? So basically this is nothing but fluid in the pericardium. Okay, so this can lead to death, rupture of the heart. Then other sites of rupture of heart will be the intraventricular septum, rupture of the papillary muscle, rupture of any of these sites usually within the first week, and it's going to be fatal. Okay. Cardiac aneurysm, another 5% patients of acute myocardial infarction, they develop aneurysm. Often this will be of the left ventricle again. So cardiac aneurysm, left ventricle again, they're focusing on the ventricle. It occurs in healed infarcts. Okay, in healed infarcts it can occur because of this scar tissue, right? Because through this thin, fibrous, non-elastic scar tissue, there can be aneurysm in the ventricle, left ventricle. So basically this can impair the function of the heart, right? And the common sites are this left ventricle, right? So rarely the calcification of this aneurysm also can happen. Of aneurysm can happen. Aneurysm spelling, you know, aneurysm. Okay? A-N-E-U-R-Y-S-M. Okay? So basically cardiac aneurysm, left ventricle usually, then there can be calcification of this aneurysm. Pericarditis can happen, that means the inflammation of the pericardium, correct? So basically they are calling this as sterile pericarditis, okay, because there is no infection here. But it's still there's an inflammation, correct? Sterile pericarditis. So basically this can also be associated with fibrinous pericarditis and also be associated with pericardial effusion, right? So this will be a sterile pericarditis, but this can resolve by itself. This resolves. This is the only good thing we heard so far. It can resolve spontaneously. Last one, post-myocardial infarction syndrome. What is this? So patients who have suffered acute myocardial infarction, in just about 3% people, they develop post-myocardial infarction syndrome, or it's also called as Dressler's syndrome. Okay, also called as Dressler's syndrome. This is just seen in 3% cases. They are saying 3% cases. 3% please. 3% cases. Yes. They see this. Basically what happens here, it occurs 1 to 6 weeks after the attack of myocardial infarction. Note the timing. It is 1 to 6 weeks after the attack of myocardial infarction. It is characterized by pneumonitis. Okay, it's characterized by pneumonitis. So it can be mild symptoms only. They don't know why this happens, but there is going to be some autoimmune reaction probably, and circulating anti-heart antibodies in the serum of these patients. So basically they will get what? Pneumonitis. After 1 to 6 weeks of MI, there will be pneumonitis. Okay, there can be pneumonitis. Why they don't know exactly? Because they are guessing that in these people there are some auto-heart antibodies against the heart, right? So anti-heart antibodies in the serum will be there. Okay. So that's all are the complications of myocardial infarction, guys. So basically what did you study in this video? So you have studied the complications of myocardial infarction. So many of them, in 80% of the myocardial infarction there can be complications. These complications themselves can lead to death. Okay. So basically arrhythmias can happen ventricular fibrillation can lead to death. Congestive heart failure like ventricular failure can lead to 40% death. Cardiogenic shock where the systolic blood pressure is less than 80 millimeter mercury and hypotension can happen. Mural thrombosis, thromboembolism can happen. Rupture of heart itself can happen. Usually the ventricular wall will rupture. There can be tamponade fluid in the pericardium. Death can occur. Cardiac aneurysms can happen, especially the left ventricle. Calcification of this aneurysm also can happen. Pericarditis, it's a sterile pericarditis. It's an inflammation without any bacteria or any microorganism, right? So this resolves by itself. Post-myocardial infarction syndrome is also called as Dressler's syndrome. Dressler syndrome, basically in 3% cases this can happen. It happens after 1 to 6 weeks of myocardial infarction. There this person will have pneumonitis. They will have anti-heart antibodies in their serum. Okay. So these are the complications of myocardial infarction. So we have completed the complications of myocardial infarction. Bye bye.